scientific program, so as conducted by Institutions Innovative Council of Mallarity College of Pharmacy. So today our theme, which we are going to look into, is the digital health revolution. I think you might have known about digital health. So this has become a very hot topic, and a lot of developed countries are making a way stride progress. In this case, here today we are having a simple brief glance about how this healthcare delivery is going to happen across global health systems. So we are comparing how one is different from another and how their ideologies and how their approaches are changing. Okay. And after that we are going to see what India has been progressing upon. Okay. So this is going to be our subtitular theme, data to decisions. You know, we have one common proverb, knowledge is power. But here what I would say is having a profound and a rational knowledge would give you a greater chance of decision making. So that's what. Here in our pharmacy field, you are going to come across a word called as a clinical decision making. So what makes a clinical decision making accurate is your judgment is based upon the evidence. That evidence is nothing but the data. So whatever the data you are gathering, if that's going to be very much accurate, that's going to pinpoint either the problem or the solution. Okay? So we'll be having a very brief things sorted out one by one. So these are just simply an abbreviations. We will not be looking into all kind of abbreviations. The only important thing we are looking for is Ayushman Bharat. I think most of you have known about Ayushman Bharat, right? So it is a flagship scheme introduced by the central government. So that is nothing but nowadays we are getting a digital health IDs. That is called as a Aadhaar card. So everybody is getting registered and they will get like their own Aadhaar card, just like you have your Aadhaar card and PAN card. So that is also nothing but a very important step in digital health. So when you just click on and when you log into your account, you have all the relevant medical details and your previous history and any kind of procedures or diagnostics, all simply carried through one app that is present in your particular account. So that's called a digital health ID card called as a Aadhaar. So that is nothing but an initiative of this Ayushman Bharat digital mission. And also we have other simpler forms. Here we can say artificial intelligence, and you would have been knowing it very well, COVID Vaccine Intelligence Network. I think most of you have used this app called as a COVID app, right? Because you might have once or twice the vaccines. So you could have got a certificate, a vaccination certificate. You might have seen it is a digital certificate with a QR code. So that gives a very accurate details if you would require to travel or would go any other way. Okay, so this is also nothing but it was a digital initiative. Unlike other countries, we were the very prime member to introduce this digital concept in vaccine certification. And also we have another important element called as the electronic health record. So these electronic health records are being adopted in all sophisticated hospital systems. Now Indian government is also promoting the same. So if you would just wander from one hospital to another, you had your condition treated in one hospital, and after some time you might go to another hospital. You need not carry the reports. Some might go missing, or some might even not be possible to interpret. So in that way, if they would be digital, it is easily accessible by any doctor, anywhere in the country, to treat and to understand your diagnostic elements. Okay. And also we have other things like health facility registry and also health practitioner registries. It is nothing but a compilation data of all the eligible doctors, or we can say as a medical practitioners, being listed into that account. So that gives a transparent understanding of whom you are being treated. So apart from that, we are going to see a very simpler things like real world evidence. This has become a very hot topic for the pharma industry. As you know, new drugs are being sorted out as they are being discovered. And if I want to put a price tag, first I need to show its efficacy. And if I need to show its efficacy, I need to have all the clinical documentation that gives an evidence. This drug has nearly a perfect chances to become what it has been claimed. So that is going to be through real world evidence. So that is usually combined with a concept called as a HEOR, Health Economics and Outcomes Research. So that has been a prime topic. So we'll be just going through one after the other. So what digital health? So as we are speaking digital and everything being digital, so it is nothing but only a communication philosophy and information technology. So where you can able to connect illnesses or you can promote wellness and as well as a delivery. But the most significant thing you are going to say is integration of technology. So you are incorporating new technologies. So that is a data is being transferred. Or else like you are registering a new data. So that means you are getting a new app. So we have even an examples of an app. So for a pharmacy, like you would not go for actual physical pharmacy. You just simply have an account in that app and you can just order your medicines, right, delivered to your house. But some would require uploading of a prescription because certain drugs would do so. Obviously you are uploading a prescription by taking a photo. So that means it is giving you more and more convenience and as well as a transparency for them. So in that way it is making everything leaning towards a digital era. And also here we can see in digital health, other apps you are going to observe, M-Health, so that is called as a mobile health. So simply not a mobile health, like this was being developed in United States to one particular hospital system. So in one hospital, let's say Michigan Hospital, they have been using a particular app in order to identify any problems that are faced by the pregnant women in all trimester cycles. Instead of coming to the doctor, like they could be reporting to the app any difficulties or discrepancies. So all small sort of things could be addressed through telephone. Until or unless if an emergency is going to persist, they'll be taken into emergency care. So that would avoid time and even for the doctors also. And also we can see telemedicine. Here we have in our country the same thing, telemedicine. So where teleconsultations are going to happen, apart from the physical consultations. I think you might know about an application called as a Practo, right? I think a couple of you might have gone through. Did you see Practo? Website Practo? You did not see? Like you can just go into the website and you just type down like nephrologist near Jubilee Hills. So you just type down a specialty and a location and it's going to list out all the doctors' names, their experience and their patient ratings. So obviously we have a tendency to go to a doctor who has the highest ratings, 4.8 out of 5. So when you compare to a doctor who has 3.4 out of 5. So those are directly coming from the patients. So privacy has been protected, a patient gives a review. Particularly if you are going for a kidney specialist, you are going to see how well it is being treated, any complications. If all the patients are going to report everything went smooth, obviously you are going to prefer the doctor. So all those clinical decisions, so from the patient behavior is going to be influenced through technology. Highest ratings means highest consideration. All those things, and apart from that we have artificial intelligence and analytics. You know AI, right? So if you just prompt something, obviously AI is going to generate a data. Apart from that, here you have certain amount of data. Obviously you are going to upload the data and you are asking AI about particular questions from the data. Instead of you visually looking into all the elements of data, you are simply prompting a question. Only that question related data is going to be excluded and it is brought to you in a very sentence format. So this is what even in healthcare, this analytics have been improving. You know about X-rays or CT scans, you would directly give a physical report to a doctor and they are the only ones who are capable to examine. So here what happens is, in artificial intelligence, such kind of reports have been accumulated and over a period of consecutive years, so that was incorporated into artificial intelligence systems. Through machine learning, the computer model has been persistently learning where the problem would arise in one particular CT scan of a particular organ. That means the computer model has been trained repetitively where the problem has been occurring. So through that, what happens, whenever you are just uploading the data into an AI analytics scan tool, automatically it is pinpointing. Even it is pinpointing a minuscule changes, like a small tumor, which would doctor find it hard to difficult, that is being explored through artificial intelligence. Such technology have been generated. So that is through AI analytics. So that is nothing but computer model is going to get trained repetitively. Just like for your understanding, if I would train you 3 ones are 3 and 3 to 6 and 3 is 9. Obviously you would be adding 3 number each time in order to get to the next number. Obviously you have been trained for up to 5 numbers. If I would ask you what is the 6th number, because you know you are trained, you just have to simply add 3. Automatically you can answer 6th number based upon the training of previous numbers. Here the analytics is also going to do the same thing. It is repetitively trained. In this particular scans, you are going to observe this particular tumor or this particular discrepancy in a tissue, finally leading the perfect output. So this is what it's going to be a market size, and absolutely it's going to be a very whopping number. So $285 billion projections, it's good. So where, and also you can see most probably which country has been the most to invest in digital health is United States. And even in case of UK, NHS is trying to adopt the digital health, where majority of the British people have been voting that they would require digital health and literacy also. They are aware how to use a digital health. And in case, as I spoke about in Indian environment, the main problem is you might bring the digital health concept and their applications, but the digital health literacy is less comparatively. So the main agenda of our Indian government is to first develop digital health literacy. You have to educate the people how to use these digital apps, and later on you might be going to the real-time applications. So what are the things which are actually prompting us to use digital health? So most probably you can see aging population, chronic diseases. Because a lot of aging population, they cannot access healthcare services all the time. So through digital way, they might actually have a grievance mechanism in order to address any kind of a small issues that will be rectified in an easy way. And also it leads to value-based care adoption. So that means value-based is nothing but here it is a personalized approach. So what your problem has, persistently how you have to get treated. So that philosophies are being turned. And country highlights, here we can see all the countries are adopting EHR, as we have spoken about, electronic health records. So that has been a major important target, and all these are adopting with the greater investments, where VC is nothing but venture capital. So you just have a business idea, but you don't have money. Your concept is brilliant, so, but somebody should invest you. So that investing part will be usually done by this VCs. We call that as a venture capital, and that seed fund is generated for us, those who want to show an initial result. If your concept is actually working out, later on the people might come forward and invest in your company. So that's what here you are going to observe. All changes are going to be imminent for all countries, and we can see the most significant thing in recent times is played by Singapore. So it is trying to make all the hospitals very well connected through operators, sensors, and all digital equipments along with the digital health records. And it is usually adopted through National University of Singapore and Nanyang Technological University. So these two universities are striving to make digital health easily accessible. And also we can see South Korea. As we can see, South Korea is more progressed. These are using a network frame of 5G in all their healthcare applications, tools, and IoT. You know IoT, right? Internet of Things. So that is a well-connected application network. So that is even useful at a household level. Okay. So this we are talking about India, right? So as in case of India, like most probably we were looking into an interoperable accessibility. So interoperability is nothing but within the healthcare system, we just want to establish a healthcare records so that it is easily accessible and operable. So just like you would join in for a Yashoda, and after that, sometime you may join in for a AIG. So if I would ask for a physical record, it would be very difficult for you to extract, or some things might go missing. But in case of this EHR concepts, it is unique for a patient, and the patient care provider is directly going to access that record without asking anyone or authentication. So these are going to be quite possible and have been discussed in Niti Aayog. I think you might know about Niti Aayog, right? So these are the developmental goals which have been proposed by the Niti Aayog. So all these platforms here we can see, as I am saying about Ayushman Bharat, so Aadhaar cards were the main proper first agendas that were going on, and after that even we can see this COVID platform. COVID platform. So as we have said that about a vaccination things. So this was the first part from our Indian government during the COVID pandemic. So a lot of other countries like African countries and few other countries have impressed by this COVID app and have asked for an open source network from our country, and obviously we have given them. So it was a very good intuition. And this is a concept we are talking about, this telehealth, teleconsultation service. So more concepts would be gone through this name, eSanjeevani telemedicine platform. So the goals were quite higher, and it is usually implemented by CDAC. So that is for Advanced Computing Institute. So that will be taking care of everything, where by 2025 they have observed 15 crore teleconsultations have happened. So these consultations have proved to be great, and most probably healthcare workers have connected up to 1.2 lakh people. So a lot of teleconsultation changes have been there, and all these are going to be having a focus through National Digital Health Blueprint. So when if somebody asks you for a blueprint, so that is nothing but a plan or your execution strategy. So all these have become into an execution strategy, because if somebody is asking, like, you are dealing with the data, you are collecting a data and you are integrating a data, and also you are cleaning a data. And next concern is data privacy. So whether between the interoperational changes, is there any threat to the data? So that is important, because when you even download an app, that would ask you for permissions, storage, contacts, gallery. So you had one concern, if you do not know the app well, obviously you would not proceed further. But this is a very quite different, and it is encrypted, and it will only be operably changed from one institution to other institution. So there is no probable interference. So it will be running through all ethical guidelines with the data science manual. Okay. So global impact, simple. We have made a common source as an open model. You know what is an open model, right? So that means I am not just putting any kind of a proprietary mark onto that. So it will be openly accessible, and it could be changed. The phase of this WHO Digital Global Health Mission. And also we can see in case of Ayushman Bharat, and you can see unified health interface. When we are talking about a unified health interface, so here we are speaking that as we are sharing knowledge, knowledge sharing things. So not every exports are directly materialistic. Even we have in our defense also. So not the, in certain cases the companies would like to share the knowledge where we can domestically manufacture the products through the acquired knowledge. So in this way, the India not alone being a materialistic producer, but also a knowledge sharing companion. So it has been providing the sources to all the accessible institutions. And global partnerships, we can see WHO has been there, and G20, right? A lot of conferences would happen, like G20 conference. You might have seen in the news. So here we can see that this G20 would also have been looking into this global health initiative. So that means we are not just decided only to one part, and we have to cover the whole global partners that are associated with India. And we have been seeing about capacity building exports. That is nothing but technically whether the India has been fit. So automatically we are developing all the resources. So that is in the platform sharing, and as well as development and testing the tools sandbox. So as the startups are being important, like you have to test a tool, a new application. So instead of without scrambling the current use of application. So that we are going to test in a separate area, like sandbox. So those kind of testing tools have been developed, and since then we have been seeing more than 40 startups. So that were more useful for healthcare alone. Okay. And this is what we are saying about AI-enabled data science. AI is everywhere. So as I'm saying that the one which doctor finds hard to diagnose or pinpoint the location, or you cannot see an initial changes in the pathological events. So all these are usually done through AI. Nowadays you can see in case of famous diagnostic labs like MedPlus example, you can see AI-enabled diabetic retinopathy imaging. So one thing which you cannot have a clear access, obviously they are going to use the AI software, and they are actually looking if there is any problem with your eye. So that might develop a cataract at the very initial stage. How much risk you are in developing a disease. So that initial stages could be only observed through going through a very hard number of data sets. So that comes through experience. As you would say, how you are proficient means you say that you got through experience. But for AI, it occurs through data. So a lot of data had been gone through, and you can see some government programs that is nothing but AI-based tuberculosis programs. Even we have a portal from Government of India called as a Nikshay portal. So they are actually helping to diagnose the tuberculosis. That is through AI screening tools. We have multiple tools, so we will not name one. And also we have predictive analytics modeling. So predictive analytics, from the word you can understand, predicting, you are predicting something. Again I'm asking, how you are predicting? Through data. So based on that, if I would say that if your blood pressure was beyond the normal, but you are at near to the stage 1 hypertension, if I'm collecting more and more data, and a lot of people are at stage 1 hypertension in near, obviously I can understand, okay, from the whole population what I have collected, the majority of the population are at the risk of developing hypertension. And same with your blood glucose levels. If I'm collecting all the blood glucose levels, if I see a lot of blood glucose levels are like, beyond the 140 or anything, obviously we can make an assumption. So who would be diabetic? So that is nothing but a aggregate collection of data. So that is a pure data, not missing data. It is only going to be the clear collected data. So that is going to be important, and that will be well trained through the machine learning models. So challenges, if you are going to see, for any developing country, the first challenge is infrastructure. Obviously, a well-laid infrastructure is a requisite for any development. So that's what we say. If you want to look the progress of the country, you look the infrastructure. So in this sense, here we can see rural broadband penetration. You would not see any kind of internet activities happening at the rural stages. Only up to, it was less than a 40% where they can access an internet. So this is the problem. They cannot use any kind of data operated devices, or we can say they would not have a knowledge as well as accessibility towards the applications. That is the first problem. Improvement of infrastructure and uneven electricity and device access. So that's a major complaint you would say if you go to a very, auto station or like in a villages, you would say that you can't find enough signals. So that would also come like an infrastructure. And second thing, the most important concerns we Indians have is data privacy and data security. But we usually anyway download many of the apps, so don't have a concern, and after that, what happens is we have to give a complaint for cyber security. So if you just click on a link, obviously, so that's going to show up all the things in any positions. But in this case here we are going to see through Digital Protection Act. So this one, Digital Protection Act, is going to have a very key role in order to operate the data without any leakage. And also we have, next burden would be financial and regulatory burdens. Obviously, for any kind of a scientific context and development and innovation, it requires funding. With less funding, obviously you have a big pain, still that doesn't work well. So this is what you are going to observe. For telehealth and as well as digital therapeutic services, you would require a funding. And initial funding should be good enough to develop a very skilled results. And after that, the funding has to flow on. If that interference has happened, you can expect that would not prosper. So obviously you are going to observe these are the things where if you bridge these gaps, automatically the investments would be working well. So what are the future directions here? I can say precision medicine and as well as a predictive care. Precision medicine. So whenever we say about the precision medicine, we usually call about like a personalized medicine. You know, right? If one person is taking one medication and so does the other person is taking the same medication, some people may complain, it's working for them but not for me. How? So there's a concept called as a pharmacogenomics. So some medications do work for you, and as well as for others it may not. So here what they were doing is like analyzing your result, like a genomic result. And if I'm putting your AI tools, I might understand which drug is going to be working best for majority of the population. Then that becomes my primary choice. And after that, there's something which is going to come in a second rank, obviously becomes my secondary choice. So this is how I can predict the set of drugs which are good for most of the population, they are going to be prescribed first. So that is what precision medicine comes up, and interoperability standards. No matter our country do have a policies regarding privacy, transfer, operations and decision making and everything, but still that has to adhere to the global policy. So if a policy difference would occur, like that is nothing but the rules do not converge at that point. So that becomes a problem. So we have to be on par with all the developed countries so that we can exchange or we can transfer the information in a very transparent way. Okay. And also we have been saying about real world data. This is what? You must have a real world data in a very accurate phase without any missing data. And latest technologies have been showing for imputation. Imputation is nothing but when a data has been missing, obviously you can fill in those values based on the assumptions made from the previous models. So in that way, it is going to integrate all the data missing to be accurate, and it is giving a clear result. That means you are filling the values which are not supposed to be there, but they are actually correct of what you have filled. So these are all going to be more progressive. And finally, here we can see what could be the next decade in progress. Strengthening ABDM ecosystem, that is the first and foremost agenda of central government, and also that has to be integrated more into public and private hospital systems. So I can proudly say at Malareddy Hospital, even my PharmD students, those who are a 6th year internship students, are actively participating and are playing a very important role daily in registering the patients for Ayushman Bharat digital health ID cards, and we have been working on the projects, and we were promoting awareness regarding this digital health to all those patients who give consent. Okay. And also research translation, how your presented data could be translated and how you can show an evidence this drug is working. So there is a problem with this patient. So this is the most common disease. You are getting a data. So that has to be translated as an evidence. So that's called as a real world evidence. And finally, human capital. No matter if one person has an ambition or one person is very much great in thinking, it doesn't work. We need to have a like-minded people. India has a very human capital at a large scale. So we need a more human capital, that is nothing but the thinkers who are at extreme of that digital health, and they can carry forward the mission. So does the ethics do follow. Okay. So this was only about the glimpse I could give about digital health, given the time that was occupied for this event. Okay. So I hope you might have got this very well, and would also expect you to explore all the concepts of digital health. And again I am saying, don't take it as an easy part. Digital health is the future. I could say it is going to transcend beyond pharmacy. So all the global level systems are running on digital health. So one who is more into digital things can find themselves at a higher positions. Okay. So thank you very much.